Here is the full telephone conversation between Beverly, Ian and a Worcestershire County Council social worker, dated 26th of the 7th, 22, featured in our video overview of the abuse and neglect. As stated previously, voices and names have been disguised. In it, she gives assurances to youngest daughter Beverly that Worcestershire County Council Social Services, West Mercia Police and the Office of the Public Guardian were working together to safeguard her frail, vulnerable parents from her eldest sister, who appeared to be taking advantage of them. Her parents, Edward and Lily, were both in their late 80s and had many health conditions, including dementia, whilst her sister Susan, despite having a history of psychosis, drug addiction and criminality, had been entrusted by authorities to be their sole carer and lasting power of attorney.
So I've discussed this case with my manager. I'm speaking with the police officer that's dealing with everything on Tuesday. Following that, we will make a decision on getting a social worker involved or to see what needs to be done. And also, I think the police officer is looking at the possible financial abuse, isn't she? I don't know if you've spoken to. No one's been in touch with us on the phone. Okay. Yeah, so she is allocated already. So I will be following that up with her next week. I've also had some contact today with the Office of the Public Guardian. I put my safeguarding referrals through to recommend that I don't feel is an appropriate person to be an appointee with a history. Yeah. And in fact, they probably aren't aware of, her involvement in convictions and so on. So they are aware of that now. Right. So hopefully that will be followed up as well. So it's just to kind of put you in the loop. But after Tuesday, we'll have a bit more of a clearer plan about what we're going to do as far as your mum and dad and looking at what's happening with them care-wise and to see what's needed. What will have to happen now is that the police officer that's dealing with this, so I've checked with the police that's, that I work with. I've got contacts now for the police officer, but she's not back till Tuesday, so I'm going to be having a meeting with her on Tuesday and discuss my information that I've got, so we'll share information. I'll see if I can get her to go to the house with the information that I've got so she'll know what to look for. And then upon that, we'll be able to look at whether we need to get a social worker in there to do proper assessments and look at, support and, what's happening as far as their care needs being met. I've also sent a safeguarding contact through to the Office of the Public Guardian just to inform them that I don't feel that it's an appropriate appointee. So I'm just now waiting for the feedback on that. Now, and I know it's frustrating for you, but we can't just, without any sort of
I know what you're trying to say.
From the police, yeah. I need the police to sort of contact first, and then they normally will contact, and then they'll refer to us anyway and say, I've got concerns about this couple, or they, speak to them, and then we can look at getting somebody in there.
The thing is, we're a bit more satisfied now. We've got the feeling, me and my partner, that the ball is rolling now.
Yeah.
Oh, we were just getting so frustrated because we were just getting the impression that everyone was ignoring us. 95% chance you're going to find something bad.
Well, the fact is that she has actually had convictions, hasn't she, for drugs. So that she's already in breach of her power of attorney. So anybody that's got criminal convictions is not allowed to be an attorney. So I've informed them of those. I've informed them of that.
It's the solicitor who wrote all this stuff up. They didn't do any background checks. I think it's a thing that's going on at the moment. That a lot of these people become attorneys without doing background checks.
And then things go wrong, and then they come into safeguarding all the time. I mean, it's like a huge bulk of my work. So I've now informed the Office of the Public Guardian, so they will know, and I think they will have no choice but to revoke her
All that's going to happen is got to have some sort of injunction to keep her away, or if she wants to see mum and dad, to have someone with her, and to have mum and dad have a care package. They need peace and quiet, a couple of carers go in, that's all they need, because they're not ill enough to go into a nursing home. And that's what they're so concerned about. They keep thinking, telling them that I'm trying to get them banged up in a nursing home. And when I went round on Sunday, he was still saying that, you're trying to go. I said, oh, Dad, I'm not going over this again and again. I said, you won't go into a nursing home. If you was incontinent and everything, and things got a bit worse, then yeah, but you're fine. See, they can wash themselves, clean themselves. It's just financial abuse. And as soon as we can get somebody, once we can get someone in there, a social worker, to explain that actually putting them in a home is the last thing, especially if we're funding. That's not what we want to do. We want to keep them at home as long as we can. Even sell the house and put them into an apartment with supported living. That would be ideal for mum and dad. There are lots of other options that we would do for. And that's why I tried to get blamed. Yeah, but you know what it's like. They won't hear it from you because you're their daughter, and people don't want to hear it from their own kids. But as soon as we can get somebody in there to have these conversations and find out, but I've got to do that the right way. I have to make sure. I've got to do it the right way. Oh, I totally understand. My sister's saying they're so stressed, and it's terrible. She's trying to blame me, basically. Yeah, I know. And I can see what's going on. And I think once she's off the finances, it might be that she's not so, she's not so keen to be staying and around. Yeah, exactly. But as I say, it's all the bits have to come together at the same time, and as I say, we have to evidence things. We can't just go in there and say, right, I know, we're going to take over. Unfortunately, even though So, of course, I've tried to phone the doctors to find out if this mental capacity test has been done, the blood test. And of course, they can't tell me because my dad told this doctor not to discuss their medical records with me anymore. So, of course, the doctors couldn't tell me that information today, but you can find out. I can find out, yeah. Yeah, and ask if she has had the mental capacity test done and if she's had a blood test, if they've had blood tests for illegal drugs. And you see, the mental capacity assessment test, it's not just a test. It has to be about a specific thing. So if we, our social worker, when I get a social worker in, I will ask them to do a capacity assessment test, and we have to do one about whether they can understand to manage finances, one about their living and care needs. Each one of these has to be decision specific. So the GP is not going to just do one and say, yes, you've got capacity, or no, you haven't. It has to be, there has to be a question, does this person have capacity for a particular thing? Yeah. They have with regards to cooking, eating, washing, dressing, but it's it'll be around decisions about can you manage your own finances? That's one that we would do, and that's one that I would ask the social worker to do when they go in. And the other one is around their care needs. Do they understand that if they've got any care needs? Do they understand and about making decisions about if they move like to an extra care or supported? We would need to get them around that. But that's all. Yeah, there is, and it's not. I can't imagine that a doctor would just do a blood test to say no, you haven't been drugged with heroin. I mean, if a doctor did do that, they would have to report that to the police and probably safeguarding as well. So I can really probably get a bit more information after when I get the OPG get back to me. Yeah. I speak to PC on Tuesday, and then we can have a good plan about what we need to do next. And I will, I'll keep you updated. Oh, that's fantastic. Yeah, thank you for that.
In the end, neither Worcestershire County Council Social Services nor West Mercia Police bothered to get back to us. They simply went away and ignored the situation. Annoyingly, this has happened time after time, with authorities continuing to ignore us, even to this very day, as serious issues continue to surface.